Pressure ulcer prevention and management is one of the key aims of the organisation of Nottinghamshire Healthcare Trust, and our ambition is to, where we can, eliminate avoidable acquired pressure ulcers with the patients that use the services that we provide.
Staff are starting to really think now around the process and why they're being asked to do the things that they are doing, and people are starting to realise the impacts of the actions that they're doing and starting to engage much more in the whole tissue viability pressure ulcer prevention agenda, because they can see it. It's very visual for them.
When I came into primary care, what I realised quite quickly is that I was in a very privileged position. We were there and we were able to support patients to prevent them getting to a point where they need to access acute services. If we assess patients at the beginning and we see their problems and we work out what's happening, all the agendas, all the documentation, all the changes that have come, once we've grasped them, we can use them as tools to be able to enable us to provide the right care for patients in the right environment for them.
For the staff in the homes, it also gives them the knowledge, and they are catching pressure sores, pressure damage at an earlier stage than they would have done previously. We use a patient information plan, which obviously is you go through this with your patient. It's something that they need to be involved with and to understand. Obviously, we go through these with the carers as well in the homes. It's not just people that with pressure damage that we do these information plans with. It's people that are at risk. So it's catching people early. Before they have a problem.
Fundamentally, it's about making sure the patient has a really, really good experience of our services. But also there's an enormous cost attached to pressure ulcers as you're trying to treat and heal them. What we expect from our staff is that they're committed to provide the best high quality care, which is also safe and effective to any of the patients that are touching our services. And what that means is that we are committed to supporting all of our staff with the education they need and the training to enable them to act effectively.
A bed sore. Oh, terrible. Anyway, the wife got in touch with district nurse. She came. Got me on the bed. Had a look. Oh, horrible.
So community nurses now, if they go and do a visit with a patient and they identify that a patient has indeed developed pressure ulcer, whatever the grade of that pressure ulcer, they now record that on Ulysses as an incident. The beauty of the data is actually what's changed the hearts and minds of staff, because actually what we were asking them to do was increase the demand on their workload and deliver a lot more work up front in the pathway. So what we could share with staff was, yes, we know you're really busy, and yes, we know that you're saying that actually we've implemented many more things for you to do in the pressure ulcer agenda, but actually look at the impact of what's happened. Many more less grade 3 pressure ulcers than you had before, so the beauty in your efforts is absolutely evident.
The organisation and the tissue viability team worked really hard to create documentation that was user friendly, that enabled people to, and staff alike, to assess patients in their own home. We've responded to that, we've listened to your concerns, and we've created a new pathway. We assess, we plan, we implement, and we reevaluate. On that reevaluation, we then start the cycle again.
Obviously, preventative care is really important. It's really important to me, to the patient, to everybody. The extent of some people's damage is just unbelievable. I mean, you can see bone, and you're having to pack, and they've got to put up with the smell and the pain. And it's just heartbreaking, really, because you know at the end of the day, had we put a plan in place early enough, that could have been prevented.
It made me quite unwell as it got infected. I ended up damaging all my shoulders and ended up putting pressure on my bottom, so I ended up with a pressure ulcer there. I ended up bedbound, and that's when the district nurses got involved, coming in, dressing it. I ended up having to go to hospital where it was debrided, and I had to spend 10 weeks in hospital because the wound ended up really big. And then I came home and I've been in bed ever since.
And locally here, we've had the tissue viability specialist nurses working very closely, shadowing and going out with staff on one-on-one. So we've been able to engage all parts of the system together to help staff learn and understand.
The 6 C's is a fundamental framework of how we choose to operate, and it is particularly relevant to pressure ulcer prevention and management. And where we're talking about pressure ulcer, prevention is the key.
Before I was really independent. I did everything for myself. I didn't have any carers. I could drive, so I used to do my own shopping, take the kids to and from school. I was at college, just did everything.
There has to be active communication, not only with the patient so they understand what we're trying to do, but also with their relatives and their family, who may be the informal carers. And also there's an expectation that staff communicate with each other, so we're providing consistent care.
It's the kids that are the hard ones, because they suffer. They've really suffered this past year. I could get through it by myself, but with the kids, I just feel so guilty.
But we want our staff to be courageous to say, actually, this isn't right. And what are we going to do to make it right?
When I first started as a tissue viability nurse for the organisation, I didn't realise how much I'd enjoy it, how much I'd love it. What's fantastic and the best bit about it is when I do joint visits and when I see nurses going in with relationships and rapport with patients. When they see what they want to do and how they can help. For me, that's the fundamental and essence. Being a nurse first, caring, and I see it every day.
What I am asking of you is that you take this agenda seriously. You work with us, you let us know when you need things that aren't there, and you help us to provide our patients with the best care possible to enable them to have a safe journey whilst they're with our services and not have to undergo the indignity and the pain which pressure ulcers cause.
It was terrible. Honest to God, I don't wish that to anybody. I was nearly crying. And it took sense every time I think about it. It really does.
We are all working to the same goal. We're all using the same paperwork. We've been trained the same way on it, which makes a big difference into how we are then caring for the patient. But everything that we've got in place now is going to improve.
I think we're seeing changes in staff, and with the reduction of 60%, that's phenomenal. That's the prevention work, and that's us proactively keeping patients healthy. See that smile when you go in and get a hug and know that your changes or that support means so much to them. That's it for me.